Hello, my name is Brandy Straface. I'm a physician assistant at the United Hospital Center ENT and Audiology Clinic. Today, we're going to talk about pediatric ENT health. Nerve hearing loss, also called sensorineural hearing loss, is permanent. This is caused by genetic factors in half of cases. The other half of cases may be due to infection, such as meningitis or congenital cytomegalovirus, also called CMV, head trauma, noise trauma, anatomic abnormalities, or certain medications. Sometimes a cause can't be identified, which we call idiopathic. Conductive hearing loss is usually temporary and caused by fluid in the middle ear, or an abnormality of the eardrum or hearing bones. The middle ear is the part behind the eardrum where 3 tiny bones connect sound from the eardrum to the cochlea, the nerve part of the hearing. The middle ear is the area where ear infections occur. Ear infections can leave fluid in the middle ear after the infection is gone. On the other hand, some children can get fluid in the middle ear when the tube from the nose to the ear, the eustachian tube, does not work well. Avoiding loud noises and head trauma will prevent hearing loss and may prevent hearing loss from getting worse. Some symptoms of pediatric hearing loss include speech and language delay. A child is not babbling or babbling has stopped. By 12 months, the child does not understand simple phrases such as wave bye-bye or clap hands. By 2 years old, the child should have 50 words and be able to put 2 words together. Not turning heads in directions of sounds. And difficulties in school. The earlier that hearing loss is diagnosed, the sooner appropriate treatment can be discussed and implemented to help your child hear and speak as well as possible. To make a diagnosis of hearing loss, different types of tests can be done, depending on the age of the child. These include OAEs, otoacoustic emission tests, ABRs, auditory brainstem response testing, and audiograms, which is a standard hearing test. We also do tympanometry, which checks eardrum function. For temporary hearing loss, sometimes a simple visit to your doctor to remove earwax, perform an outpatient ear tube placement, or other medical treatment can correct the hearing loss. For permanent hearing loss, hearing aids, bone-anchored hearing aids, FM systems, and/or cochlear implants may be recommended, depending on the type and severity of hearing loss. In addition to an ENT, ear, nose, and throat specialist, or otolaryngologist, children with permanent hearing loss should be seen by other specialists, including an eye doctor, an ophthalmologist, and in some cases a heart doctor, a cardiologist, and a genetics doctor. It is important to also consider speech therapy as soon as a diagnosis is made. If you should have further questions or need to make an appointment, please contact UHC ENT and Audiology at 681-342-3570.